Why is Eruv maintenance seen as a burden for Jewish health care? Imagine needing to carry life-saving medication or a mobility aid on Shabbat but being unable to because of strict rules. That's where the Eruv comes into play. An Eruv is a boundary that makes it permissible for observant Jews to carry items outside their homes on Shabbat. But keeping this boundary intact is not simple. It involves ongoing work that affects health care in many ways. The main challenge is the strict halachic standards. The boundary can be wires, walls, or natural features, but they must be continuous and unbroken. Any small tear or break makes the Eruv invalid. This means regular inspections are needed, often weekly, to check that all parts are intact. If a wire is loose or a pole is damaged, it must be fixed quickly. For health care, this is critical because patients often relying on carrying medical devices or medications outside their homes. If the Eruv is broken, they cannot carry these items, which could delay treatment or emergency care. Maintaining the Eruv also involves physical work. It requires checking wires, poles, and leased properties that from the boundary. Sometimes, repairs are needed, which can be costly and time-consuming. For example, wires might need to be replaced or realigned, and this can take hours or even days. The costs can add up, especially for large Eruvs that cover many neighborhoods. Another aspect is the coordination with local government authorities. Many Eruvs are in public spaces like parks or streets, they requiring permissions or leases from city officials. Managing these agreements can be complicated and may involve legal and administrative steps. If permissions are delayed or revoked, the Eruv's validity can be compromised, impacting healthcare access on Shabbat. For patients and healthcare providers, a broken Eruv means restrictions on carrying essential items. This can hinder timely medication delivery or the use of mobility aids like wheelchairs or strollers. In emergencies, this can be especially problematic. If a person needs to carry an oxygen tank or a life support device outside their home, a broken Eruv could prevent them from doing so legally. Balancing halachic laws with healthcare needs adds another layer of complexity. Healthcare providers must work with community leaders and rabbis to develop plans that respect religious laws while ensuring health and safety. This often involves careful planning and consultation. They might prepare alternative solutions for Shabbat, like preloading medical supplies or using special permits. In many Jewish communities, hospitals and clinics coordinate closely with Eruv committees. They monitor the Eruv's status and educate staff and patients about its importance. Some institutions even have protocols for emergency situations if the Eruv is temporarily invalid. This teamwork helps ensure that healthcare continues smoothly without violating religious laws. So, the ongoing maintenance of the Eruv is more than just community work. It's a vital part of ensuring that observant Jews can meet their health needs on Shabbat. It requires constant attention, resources, and cooperation, making it a significant responsibility within Jewish healthcare practices.